Hello guys, welcome back. The topic that we are going to discuss today is the pleura. Okay. Pleura. Now I will try to keep this topic as short and simple as I can. Okay. So what is a pleura? Pleura is basically a covering around the lungs, right? We have a covering around the lungs which is known as a pleura. So this pleura, it is basically a sac-like structure. It is a sac covered by mesothelium, alright? It is covered by mesothelium. So pleura, it is a serous membrane which is covered by mesothelium. There are two sacs on each side of the mediastinum. Okay, now what is a mediastinum? Now in the thoracic cavity, right? In the thoracic cavity, the most important structures that we have are the lungs and the heart. So if I take a transverse section of the thoracic cavity, it will look somewhat like this, right? This is a transverse section of the thoracic cavity. Now in the thoracic cavity, we know that it is occupied by the lungs. If these are the lungs, right? It looks like a face, yeah, eyes. Okay, so in the thoracic cavity, the lungs are occupying the major portion, right? The major portion of the thoracic cavity is occupied by the lungs. So the space which is left out, which means this space, let me mark it with a different color. This space, right? The space in the thoracic cavity in between the two lungs is known as the mediastinum, right? So in the mediastinum, around the mediastinum, there are two sacs on each side. Okay. Now let's take it to the lower level, that is the embryology level. During the development in the embryology, what happens is in the mediastinum, there are two sacs, right? There are two sacs. So the lungs, if this is the sac, right? If this is the sac, what happens here is the lungs, it tries to invaginate this serous membrane or this sac from the middle side, right? If this is the body, this is the lateral part, this will be the middle part. What happens is the lungs tries to invaginate from this middle area, right? So with the lungs, it invaginates inside in this position, right? In this position. So what happens is this structure, right? The structure which was earlier a circular structure, a round structure, now it will have a layer in this way, right? A very simple structure. You should not get confused in this. Right? Just take an example of a balloon, okay? Now, if this is a balloon, right, and if there is a structure which is trying to invaginate in, right, this balloon will assume the shape of somewhat like this, right? If there is a structure trying to invaginate over here, so the balloon will now assume the shape of something like this, right? This is what is happening to this pleural sac. Earlier there was a sac, a circular sac. This lungs, it invaginates the lungs from, invaginates this pleural sac from the middle side, right? So as soon as this starts invaginating into from the middle side of the sac, we can see that this sac now consists of two layers, the outer layer and the inner layer, right? The outer layer, this is known as the, there are two layers, the parietal pleura and the visceral pleura. Right, so the name itself suggests visceral means the inner one, which is in contact with the lungs. So this inner layer, this is known as the visceral layer, right, or the pulmonary layer, and the outer part, this is known as the parietal pleura. So this is the parietal pleura, the outer part, and this is the visceral pleura. Okay, I hope this is clear. So the pleura, it is a sac covered by mesothelium, right? In the mediastinum, there are two sacs on each side of the mediastinum. When the lungs tries to invaginate it from the middle side of this sac, right, we get the two layers of the pleura, that is the parietal pleura, which is on the outer part, and the visceral pleura, which is in close approximation with the lungs. Right. Okay, now if we look here, if we come to individual pleura, if we talk about the visceral pleura, first of all, let's start with the visceral pleura. This visceral pleura, or it is also known as the pulmonary pleura, right? Visceral pleura or the pulmonary pleura. Now, the name itself suggests that this is in close approximation with the lungs, right? If this is the lungs, the visceral pleura is in attachment with these lungs. So the visceral pleura, it covers, or it covers the surface and fissures of the lung, right? Fissures of lungs. The visceral pleura, it covers the surface and the fissures of the lungs except around the hilum, okay? Except around the hilum. Except around hilum. Okay? What is a hilum? Hilum is basically a space through which structures are either coming out or going inside, right? In the lungs, we know that the main function of the lungs is exchange of air, right? So there has to be a vein, the pulmonary veins, and the pulmonary arteries, right? We will get to it in detail in the topic lungs. So hilum is around a structure through which structures are either coming out or going in, okay? So only that portion, that is, if this is the lungs and if this is the hilum, all the area of this lungs, right, the visceral area, is covered by the visceral pleura except around the root, I mean the hilum, except around the hilum. In this hilum, what happens is, we have already seen in the previous diagram that when the lungs has invaginated the pleural sac was somewhat in this diagram, right? Now, if I draw a lungs in a different color, let me make it in a red color. If this is the lungs which has invaginated from the middle part, you can see that the pleura, right, this is the hilum of the lung, right, this is the hilum of the lung where structures are coming in or going out. So around this hilum, you can see that the parietal pleura and the visceral pleura, they are coming together as one, right? I mean, they come in contact, they are continuous with each other. So this visceral pleura, the inner pleura, it covers the, you can see over here as well, it covers the surface and fissures of the lungs except around the hilum where it gets continuous as the parietal pleura, right? So the structure, sometimes it might be asked that the visceral pleura is covering the surface and the fissures of the lungs, but which is that portion that the visceral pleura doesn't cover? So the answer is the hilum, and there is one more structure, that is hilum and along the attachment of pulmonary ligament. Alright, so these are the two structures which the visceral pleura is not covering. What is a pulmonary ligament? Now this is a very important question. Pulmonary ligament is actually a dead space, right? If I draw a diagram, let me draw a diagram. Now in the topic lungs, I'm sure you have come across a topic or the heading which is known as the root of the lung, right? So in the root of the lung, you see the diagram, something like this, right? There are many structures in here, like the veins, the arteries. Actually, the veins will be drawn in a red color over here, right? we have the artery over here. Okay. Now in the root of the lung, this extension, right, this fold of extension is known as the pulmonary ligament, right? So the parietal pleura, now listen carefully, the parietal pleura which extends along the root of the lung is known as the pulmonary ligament. So this area is known as the pulmonary ligament, this one, the pulmonary ligament. Now what is the main function of pulmonary ligament? This pulmonary ligament, it actually behaves as a dead space. Right. This pulmonary ligament, the area itself consists of some lymphatics, okay, areolar tissues which contains some lymphatics. And this pulmonary ligament, this space, it actually behaves as a dead space. Why is this space required? Now imagine when we are breathing normally, right? When we are breathing normally, there is no function for this space. But when there is an increased venous return, right? When there is an increased venous return, the veins over here, this will start to expand, right? This will start to expand if there is an increased venous return. Normal venous return, there wouldn't be any expansion, but during the increased venous return, there has to be an increased space. I mean, the increased venous return will cause these veins to expand enormously. So if there is no space, where will these veins expand? Right? So at this point, this dead space comes into action. These veins, they can go and expand over this space. Right? So this is the main function of this pulmonary ligament. Right? So pulmonary, you have to keep in mind one thing, that the pulmonary ligament is derived from the pleural ligament. Okay? It is derived from pleural ligament, not the pleural ligament, the parietal pleura, sorry. The pulmonary ligament is derived from the parietal pleura. It acts as a dead space for the veins during increased venous return, right? During increased venous return, these veins, it will dilate or this will expand, and this dead space will allow the space, and it will give the space to the vein so that this can expand easily. Okay? Alright. So, coming back to the visceral pleura. This visceral pleura, it covers the surface and fissures of the lungs except around the hilum and along the attachment of the pulmonary ligament. These are the two points or two areas where the visceral pleura is not covering, because in this area, this visceral pleura will be reflected and it will be continuous as the parietal pleura. We have already seen in the diagram. Clear? Okay. So this is about the visceral pleura. Okay. Very short, very simple. Next, let's look at the parietal pleura. Now the parietal pleura, it is actually thicker than the visceral pleura. Okay. The parietal pleura is thicker than the visceral pleura, and it is present on the outer surface of the lungs. I mean, if this is the lungs, just example, if this is the lungs, the surface of the lungs is lined by this visceral pleura. So the upper portion, which means the portion of the lungs which is in around the ribs, right? This area, this part is covered by the parietal pleura. Clear? So the parietal pleura is thicker than the visceral pleura. This parietal pleura is actually divided into 4 parts. Okay? It is divided into 4 parts. Let me draw a quick diagram. Around here we have the this is the first rib. Okay. So this parietal pleura is divided into 4 parts. This area which is in approximation with the, let me take the help of my friend over here, right? The lungs is present over here. So the portion of the lungs or the surface of the lungs which is in around this costal, the ribs, the thoracic cage, is known as the Costal Pleura. Okay, the part which is around this costal cage or the thoracic cage is known as the Costal Pleura. Next, this middle part is actually towards the mediastinum, which is present in the center. So this one will be known as the, this is a mediastinum pleura. Okay, this inferior portion, this is around the diaphragm, so this is known as a diaphragmatic pleura. Right, and this portion, right, the upper portion, this is known as the cervical pleura. Okay. The parietal pleura is thicker than the visceral pleura, and it is divided into four parts: the cervical pleura, the mediastinum pleura, the costal pleura, and then the diaphragmatic pleura. Now, if we look at all these pleura separately, this costal pleura, as the name itself suggests, that it is around the ribs, around the thoracic wall, which is basically formed by the ribs and the intercostal spaces. Right. So the costal pleura is present over here, this portion, right, which is in around this costal, the inner part of the thoracic wall. So if this is the lungs, okay, if this is the lungs and this is the, or these are the ribs, right, the lungs and the ribs. This costal pleura, I am showing a diagram in this position. Okay, I've taken the lungs and the ribs as well. So this is the lungs and these are the ribs. So this costal pleura is present over here, this area, right, around the ribs, inner part of the ribs. So this costal pleura is thinly attached to the inner surface of these ribs, right, by a layer of areolar tissue, which is known as the endothoracic fascia. Endothoracic fascia. Okay, so the costal pleura is present towards the thoracic cage and is attached by a loose layer to the inner surfaces of the ribs by the loose layer of fascia known as the endothoracic fascia. Clear? Okay. Next, we have the mediastinum pleura. As the name itself suggests, this mediastinum pleura is towards the mediastinum. Right? It is more towards the middle part, but here also, since this is the parietal pleura, this parietal pleura also, when it comes towards the root of the lungs or the hilum of the lungs, because as we know, see, this is the parietal pleura, which means the lungs is present inside this, right? The lungs is inside this. So if this is the middle portion of the lungs, we know that in the middle portion of the lungs, we have the hilum. So this mediastinal pleura, it is covering the middle part of the lungs towards the mediastinum, but it also does not cover this area because here it gets reflected, right, and gets continuous as the visceral pleura. The same concept applies to the parietal pleura as well, which we have applied in visceral pleura. Always remember this diagram. Okay, this is the lungs and here we have the pleura. So this is the parietal pleura and this is the visceral pleura. Okay, now what happens is, in the next part, that is the cervical pleura. Now this cervical pleura is basically present over here, right? So the cervical pleura, it extends into the neck, right? It extends into the neck 5 centimeters above the first costal cartilage. This is the first costal cartilage, right? So the cervical pleura, it extends 5 centimeters above the costal cartilage, roughly 2.5 centimeters above this middle 1/3 of the bone, that is the clavicle. So it is present somewhere over here, right? The cervical pleura, it extends into the neck 5 centimeters above the first costal cartilage and 2.5 centimeters above the middle 1/3 of the clavicle. This cervical fascia, it covers the apex of the lungs. We know that the apex of the lungs is extends up till over here, right? So this fascia or the pleura, the cervical pleura, it covers the apex of the lungs. Now this cervical fascia is in relation to some structures present here on the neck. Let me just erase this. Let me write over here. This cervical pleura, the relations of cervical pleura. Okay, relations of cervical pleura. Now, anteriorly, the cervical pleura is related to the subclavian artery, and we know that over here, see, since here we have the first rib, right? This rib has the attachment of the scalenus muscle. Okay, so anteriorly, the relation of the cervical pleura is as follows. Anteriorly, it is related to the subclavian artery and the scalenus anterior muscle. Okay, if you study the attachment of the ribs of the first rib, you can clearly see that we have an attachment of the scalenus anterior in this rib. So anteriorly, this cervical pleura is attached to, is related to the subclavian artery and the scalenus anterior. Posteriorly, if you can clearly see, this cervical pleura posteriorly is related to the neck of the first rib. Right, so posteriorly we have the neck of the first rib, and the structures which are present on the neck, which means the neurovascular bundles. Alright, and structures around it. Okay. Oh, extremely sorry. Okay, I'll write the other relations over here because I don't have space over there. So anterior, posterior done. The next relation is laterally. Laterally, it is related to the scalenus medius, and medially, it is related to large vessels of the neck. Alright, I'm sorry because I don't have space over here, so I have to write here. Anteriorly, the cervical pleura is related to the subclavian artery and the scalenus anterior. Posteriorly, it is related to the neck of the first rib and the structures around it, which means the neurovascular bundles. Laterally, it is related to the scalenus medius, and medially, it is related to the large vessels of the neck. Alright, so these are some important relations which I think you should remember. And lastly, we have the diaphragmatic pleura. Now, since this diaphragmatic pleura is around the diaphragm, right? So it is covering the superior surface, right? It is covering the superior surface of the diaphragm and the inferior surface or the base of the lungs. Okay, so these are the 4 divisions of parietal pleura: the costal pleura, mediastinum pleura, the cervical pleura, and the diaphragmatic pleura. Keep it simple, keep it straight. Okay, all right. So this is about the pleura. Now, we have 2 spaces as well in the lungs, in the pleura. Now, during normal inspiration, we don't require any additional spaces for the lungs to expand. But when there is a forceful inspiration or a deep inspiration, the lungs requires certain additional spaces where the lungs can expand, right? So there are 2 such spaces which are known as recesses. Okay, so we have 2 recesses which acts as the extra spaces or large spaces which the lungs requires, okay, during deep inspiration. So the recesses that we have are, first one is the costal mediastinum, right? The costal mediastinum, and the second one is the costodiaphragmatic. Okay, so these are the two recesses. The first one is the costomediastinal recess, and second one is the costodiaphragmatic recess. Okay, now this costomediastinal recess, as the name itself suggests, if I draw the same diagram, this was the costal pleura, the cervical pleura over here, the mediastinal pleura and the diaphragmatic pleura. Now this costomediastinal recess is present in between the costal and the mediastinal pleura, right? So this costomediastinal recess is actually present on the anterior side, behind the sternum and the costal cartilages, right? If I take help of my friend again, this is the sternum and these are the costal cartilages. So this costomediastinal recess is present actually over here, right, in correspondence to the cardiac notch. If this is the lungs and this is the pleura, the costomediastinal recess is present anteriorly over here, okay, around the cardiac notch. So this is the costomediastinal recess, the costomediastinal recess. Alright, and the second recess, that is the costodiaphragmatic recess, is present on the posterior aspect. Right, here we have the 8, 9 and 10 ribs, which means it is present. This costodiaphragmatic recess is present around the mid-axillary line. Okay, it is present here in the mid-axillary line, opposite the 8, 9 and 10 ribs. So it is present somewhere over there. Okay, so these are the two recesses present. First one, we have the costomediastinal recess present anteriorly behind the sternum and the costal cartilages, around the cardiac notch. And the second one, the costodiaphragmatic recess, is present posteriorly or around the mid-axillary line, near the 8, 9 and 10 ribs. Okay, so these are the two recesses which will act as large spaces when the lungs requires extra space during deep inspiration. So it is obvious that these spaces we can view only during inspiration, right? Okay. Sorry, not inspiration, during expiration. Okay, because when we are inspiring forcefully, that is deep inspiration, these areas, they will get occupied by the lungs, right? So during expiration, we can view those spaces. These spaces will be empty. All right? Okay. So this is about the recesses of the pleura, the costomediastinal recess and the costodiaphragmatic recess. And one more thing, keep in mind, these recesses are also present in the parietal pleura. Okay, these are all present in the parietal pleura. Okay, now let us look at the most important point or most important topic of pleura, that is the nerve supply and blood supply of the pleura. The nerve supply and the blood supply, I have already drawn a comparison between the visceral pleura and the parietal pleura in order to save time. Now, during embryonic development, we know that the pleura, the pleura of the lungs, not only the pleura, but the pleura, peritoneum and the pericardium. All these three structures, they are derived from the lateral plate mesoderm. Alright? I'll write it over here. They are derived from the lateral plate mesoderm. Now this lateral plate mesoderm is divided into two parts, the somatic and the splanchno-pleuric. Okay? We have a somatic part of the lateral plate mesoderm and a splanchno-pleuric part of the lateral plate mesoderm. Now the visceral pleura is derived from the splanchno-pleuric part of the lateral plate mesoderm. Now since the splanchno-pleuric part is supplied by autonomic nervous system, which means the sympathetic and the parasympathetic, the nerve supply for visceral pleura is sympathetic nerves is derived from T2 to T5 ganglia, and the parasympathetic is supplied from vagus. Understand this point. Visceral pleura is derived from the splanchno-pleuric part of the lateral plate mesoderm. Hence, it is supplied by autonomic nervous system. On the other hand, the parietal pleura is derived from the somatic part of the lateral plate mesoderm. This somatic part, as the name itself suggests, it is supplied by somatic nerves. Right. So, the parietal pleura is supplied by the intercostal and the phrenic nerves. Okay, here in sensitivity, this question is very much asked during Viva, that the visceral pleura is the visceral pleura sensitive to pain or not? So the answer is the visceral pleura is insensitive to pain. Okay, it is insensitive to pain because it is derived from the autonomic nervous system. Right, so during autonomic nervous system we do not feel any pain. But since the parietal pleura derives its nerve supply from the somatic nerves, so it is sensitive to pain. Alright, always remember this point. In sensitivity, the visceral pleura is insensitive to pain and parietal pleura is sensitive to pain. Next, the blood supply or the blood, yes. The visceral part or the visceral pleura, since this visceral pleura is in close approximation or it is lining or covering the surface of the lungs, as we all know, it cannot be separated from the lungs, right? The visceral pleura. So it is also supplied by the bronchial vessels and is drained by the bronchial veins. Okay, the arterial supply is the bronchial artery and it is drained by the bronchial veins. On the other hand, the parietal layer, since it is along the thoracic wall, so it is supplied by the same arteries supplying the thoracic wall. That is, the artery, it is the intercostal, the internal thoracic and the musculophrenic arteries. Okay, the intercostal artery, the internal thoracic artery and the musculophrenic arteries, and it is drained by the azygous vein and the internal thoracic vein. Okay, so this is a comparison about the nerve supply and the blood supply. There is a very much confusion on the nerve supply. It's very simple. Visceral pleura is derived from splanchno-pleuric of the lateral plate mesoderm, hence it is supplied by autonomic nervous system. On the other hand, parietal pleura is derived from the somatic part of the lateral plate mesoderm, hence it is supplied by somatic nerves. Simple as that. Okay. So this is all about the pleura. If there are any questions, please feel free to put in the comment and we will try to see what we can do best. Okay. And yeah, that is all. Thank you so much.